Today, we will address 10 signs of liver dysfunction that can be observed on the skin. These signs indicate possible liver problems manifested through your skin. I will also explain the origin of each of these cutaneous symptoms. This content is essential for those looking to improve their health, increase energy, and quality of life. Therefore, if these goals are not of interest to you, this video may not be suitable for you. But if your desire is a healthier and higher quality life, keep watching. And for those with fat accumulation in the liver, it is crucial to pay attention to what will be discussed today. Let's begin. Hepatitis and hepatic steatosis, more commonly known as fatty liver disease, are the two most prevalent liver diseases. Each year, about 2 million people die due to these liver diseases globally, highlighting the importance of prevention, early diagnosis, and effective treatments to reduce mortality related to these conditions. There are various risk factors that increase the likelihood of developing liver problems. Excessive alcohol consumption, infections by hepatitis B virus, hepatitis C, or other variants are some of them. Hepatitis B and C, in particular, can cause chronic inflammation of the liver. While hepatitis A generally resolves on its own, hepatitis B and C can become chronic and cause serious complications if not treated properly. Obesity is also closely associated with hepatic steatosis, increasing the risk of developing NASH, non-alcoholic steatohepatitis. In the past, alcohol was the main cause of cirrhosis, but today, with changes in eating habits and reduced physical activity, non-alcoholic steatohepatitis has become the main cause of this condition. Non-alcoholic steatohepatitis starts with the accumulation of fat in the liver, progressing to hepatitis and eventually cirrhosis. Other risk factors include diabetes, poor diet, metabolic diseases such as metabolic syndrome, pre-diabetes, dyslipidemia, high cholesterol and triglycerides, use of certain hepatotoxic medications, like paracetamol, which is one of the leading causes of liver failure and liver transplant in the world. Additional infections, like the Epstein-Barr virus, can also increase the risk of liver diseases, as well as genetic factors and advanced age. Now let's move on to the signs. 10th sign, jaundice. This is one of the most typical symptoms of liver diseases. Jaundice usually affects the skin, the sclera, the white part of the eyes, and the base of the tongue, resulting in a yellowing in these areas. This yellowing is caused by the accumulation of bilirubin in the body. Bilirubin is formed from the breakdown of hemoglobin, initially turning into indirect bilirubin. Then, when bound to albumin, it is transported to the liver, where liver cells, hepatocytes, convert it into direct bilirubin. This becomes a water-soluble substance, direct bilirubin, which is normally excreted through the bile into the duodenum, a part of the intestine. When there is a liver problem, bilirubin accumulates in the body, causing jaundice. Therefore, jaundice is essentially the buildup of bilirubin in the skin, representing a clear sign of liver dysfunction. 9th sign, pruritus. Pruritus, more commonly known as itching, is another symptom associated with liver problems. When there is dysfunction in bile secretion, there is an accumulation of bile acids in the skin. This buildup of toxic chemicals in the body, resulting from liver dysfunction, can cause intense itching of the skin. This discomfort occurs because the bilirubin deposited in the skin irritates the nerve endings, causing itching. Thus, both jaundice and pruritus are cutaneous signs that are directly related to the accumulation of bilirubin in the body. 8th sign, telangiectasias. Telangiectasias, also known as spider veins, are small, dilated blood vessels on the surface of the skin. They resemble a central point from which small, very superficial vessels in the skin branch out, which lose their color when touched and regain it shortly after. These telangiectasias can appear on any part of the body, such as the face, chest, and abdomen. People with liver diseases can develop telangiectasias for several reasons. First, liver disease can cause portal hypertension, which is an increase in pressure in the portal venous system due to resistance to blood flow in the liver. This leads to higher pressure in the mesenteric veins, dilating them and increasing the pressure in collateral vessels, including the small vessels, resulting in the formation of telangiectasias. Moreover, liver problems can cause changes in vascular structure and dysregulation of angiogenesis. which is the formation of new blood vessels. These factors contribute to the appearance of telangiectasias, which can arise not only in the skin, but also in mucous membranes, such as in the gastrointestinal tract. For example, during an endoscopy, it is possible to observe telangiectasias in the stomach of patients with liver diseases. Seventh sign, dark spots on the skin. These skin spots are also known as hyperpigmentation. They arise due to metabolic disorders that result in the accumulation of bilirubin in the body, leading to jaundice, as previously mentioned. Jaundice can manifest not only as yellowing of the skin, but also as dark spots. The appearance of these spots depends significantly on the individual's skin tone. In people with darker skin, the signs of jaundice may not be as visible and the skin may not show such evident yellowing. On the other hand, in people with lighter skin, jaundice and dark spots tend to be more noticeable. These dark spots are caused both by metabolic disorders and by liver failure, which leads to the accumulation of toxic substances in the skin. The associated itching can cause lesions due to intense scratching, which in turn can result in spots from scars or post-inflammatory hyperpigmentation. This occurs because, after an injury or inflammation, the affected area may change color. Furthermore, hyperpigmentation can be influenced by hormonal deregulation and by the effects of some medications used in the treatment of liver diseases. These factors contribute to variations in skin pigmentation in people with liver diseases. Sixth sign, tanned skin. The tanned coloring of the skin associated with liver diseases is not similar to the tan acquired during the summer. In addition to jaundice, the skin can obtain a bronzed hue due to problems in the metabolism of melanin, which is the pigment responsible for the coloration of the skin. People with lighter skin have less melanin, while those with darker skin have a higher amount of this pigment. When there is a problem in the liver, the metabolism of melanin can be affected. This can result in skin with a bronzed appearance, even if the person is not being exposed to the sun. This change in skin coloration is, therefore, an indicator of imbalances in liver function and not a sign of health or healthy sun exposure. It is a distinct phenomenon from the typical tan obtained through sun exposure. Fifth sign, skin lesions. The skin lesions associated with liver diseases, such as cirrhosis, can manifest in various ways, including nodules, pustules, or abnormal blood vessels. A classic example in patients with cirrhosis is the formation of the so-called medusa head circulation. This condition is visible on the abdomen of the patient with cirrhosis, which usually has a very swollen appearance, similar to that of an enormous belly, like Santa Claus's, due to ascites, which is the accumulation of fluid in the abdominal cavity. The medusa head refers to Medusa from Greek mythology, known for having snakes instead of hair. In this medical context, the analogy is used to describe the pattern of protruding and visible veins on the patient's abdomen. These veins resemble the snakes on Medusa's head, forming a distinct and visible pattern of circulation that is an indicative of the presence of hepatic cirrhosis. This appearance is a reflection of increased pressure in the abdominal blood vessels, a common consequence of advanced liver disease. Fourth sign, palmar erythema. Palmar erythema is the reddening of the palms of the hands, which can be an indication of hepatic cirrhosis. This sign is associated with various conditions, including portal hypertension, which is an increase in pressure in the portal vein, an important blood vessel of the liver. Palmar erythema can also be caused by an increase in blood circulation in the area, disorders in vascular regulation and angiogenesis, formation of new blood vessels, dysregulation of the immune system, hormonal changes, or the accumulation of toxic substances in the body. Therefore, palmar erythema is characterized by a redness in the hands that can give the impression that they are inflamed or have suffered some type of physical trauma. However, in reality, this redness is a sign of liver problems. It is a physical manifestation that alerts to the presence of underlying conditions related to liver function. Third sign, white or pale nails. These symptoms may indicate liver problems, anemia, and nutritional deficiency, conditions common in patients with liver diseases and can also be signs of liver failure. Liver failure leads to a reduction in protein production by the liver, such as albumin, which plays a crucial role in the transport of nutrients in the blood. Due to this decrease in protein production, there may be a failure in the adequate supply of nutrients to certain areas of the body. This deficiency can result from the lack of a specific protein or other essential molecules for the efficient transport of the nutrients necessary for the maintenance and survival of cells and tissues. In summary, liver problems affect the liver's ability to perform its normal functions, including the synthesis of important proteins, leading to various health problems such as anemia and nutritional deficiencies. Second sign, petechiae. Petechiae are small red spots on the skin caused by subcutaneous bleeding, which occurs when small blood vessels burst. A common example of petechiae occurs when a child has viral gastroenteritis and vomits repeatedly. The intense effort during vomiting can lead to the rupture of blood vessels in the face, resulting in these small red spots. These spots are related to clotting problems. The liver plays a crucial role in clotting, as it is responsible for the production of clotting factors. These factors are essential molecules to control bleeding that may occur in the body. Furthermore, people with liver problems often present with thrombocytopenia, which is a decrease in the number of platelets in the blood. Platelets are important blood components for the clotting process, and their deficiency can lead to the appearance of petechiae and increase the risk of bleeding. First sign, swelling in the legs. Edema, or swelling in the legs and feet, can be a consequence of portal hypertension, a common problem in liver diseases. Portal hypertension causes the leakage of fluids from blood vessels into nearby tissues, resulting in edema. Additionally, hypoalbuminemia, a condition characterized by low levels of albumin in the blood, is also a common cause of edema in liver diseases. Albumin, produced by the liver, is essential for maintaining colloid osmotic pressure in the blood plasma, helping to retain fluids within the blood vessels. When there is a deficiency of albumin, fluids leak from the vessels into the tissues, causing edema. This is especially visible in cases of severe malnutrition, where the person does not have adequate levels of albumin, leading to a condition of anasarca, which is generalized edema throughout the body. Furthermore, individuals with liver diseases tend to retain more sodium and water, increasing the risk of congestive heart failure, which also causes edema, especially in the lower limbs. Endothelial dysfunction, another consequence of liver disease, affects the integrity of blood vessels, increasing their permeability and contributing to the edema. It is important to seek medical attention if you present any of these signs or symptoms. Moreover, it is crucial to be aware of the risk factors for liver diseases, such as diabetes, obesity, poor diet, and excessive alcohol consumption. Adopting a healthy lifestyle is the best strategy to prevent and manage liver problems. Thank you for watching. See you in the next video.